my name is Pip. I'm one of the physios at Sydney Advanced Physiotherapy in Lynfield, and today I'm just going to talk to you a little bit about back pain and your core. So the easiest way to think of your core is to think of it as a house, and a house has a roof, a floor, and walls. And if one part of that house is not working so well, so if you lose a wall, it becomes really hard for the rest of the house to remain where it was without issue. So if we look at the roof of your house, so your diaphragm, it's a dome-shaped muscle that sits in the lower part of your rib cage, and what it does is it pushes down when you go to take a breath in to help you suck air in. Your diaphragm is a super common place for tightness. I can't even tell you how many times a day I release a diaphragm, and it is not an area that many physios actually know how to release. It's not an area that we're trained to release as part of our training process at university, but it is a very, very common area for restriction. It creates a lot of mid-back pain, a lot of poor alignment in the rib cage, a lot of breathing dysfunction. It can give you that kind of little pot belly where it never goes away. Even though you've done sit-ups, even though you've lost weight, you've still got a little belly. It can create prolapses and stress incontinence. Your diaphragm is a very important area, and it needs to be able to move properly in order for you to breathe properly and to not upset the other areas of your body. Now, diaphragms can get tight and they can get weak, and they can get tight and weak. So sometimes part of core retraining involves addressing what's going on with the diaphragm. The floor of your house, the foundation of your core, is the pelvic floor. And your pelvic floor, whether you are male or female, basically sits like a little floor in the base of your pelvis. And on top of that sits your pelvic organs. So if you're a woman, your bladder, your uterus, your bowel. If you're a man, your bladder and your bowel. And what it does is it's involved in sexual function, involved in urination and passing a bowel motion and controlling when you do that, but it's also a really important core muscle. Most people just think that you can get a weak pelvic floor, but you can also get a tight pelvic floor or an overactive pelvic floor. You can be tight and weak, you can be tight and strong, you can just be weak. There's a number of different options for what can go on with your pelvic floor, and it can be just some muscles are not doing the right thing while the others are. It's a very important place to have balance in the way the muscles work. If we just look at the pelvic floor from a back pain perspective, if there are areas of tightness within the pelvic floor, what it can do is pull on your tailbone and pull your pelvis under and put your back in a not so great position for it to live. And that basically just increases the stress on the back and increases the likelihood that you'll have issues. The other thing is that it is part of the mechanism for supporting your pelvis and controlling your pelvis. And if you think of your pelvis as the base that your spine sits on, if that base is really having trouble controlling itself, then it becomes very difficult for your spine to control itself. So the pelvic floor is a very important part of your core. So you do have oblique muscles on the side of your tummy, and we're not going to go into too much detail about those because most of the time people already do too much work on those areas compared to the other areas. And we're just going to talk about the front wall and the back wall of your house still. So the back wall of your core is the multifidus muscle, which is a teeny little muscle that looks very insignificant, that goes from vertebrae to vertebrae all the way up, from your tail all the way up to your head. So we're not going to talk too much about the side walls or the obliques. What we're going to go straight into now is the back wall of your house and then the front wall. So the back wall is your multifidus muscle, and this is a very teeny tiny muscle that doesn't look very important, that is very important, and it runs from your sacrum, so from your butt bone all the way up to your head, and it's a little muscle that goes from vertebrae to vertebrae to vertebrae all the way up. Now, what the multifidus is supposed to do is when you bend over and you go to come back up, it should nip the disc out of the way so you don't pinch it as you come back up. It also controls each vertebral level to prevent shearing and shifting that you don't want at that level. What a lot of people don't know about the multifidus is how fragile it is. So when you have your first acute episode of lower back pain, the area that happened to in your back, the multifidus noticed that happened, and it will waste away by up to a third. And unless you specifically try and wake that muscle back up, it will continue to waste or stay asleep. Waking the multifidus up is something that you do with your physio. Because it's a very small muscle, you actually need to be taught how to turn it back on, and it is an extremely important stabilizer. So if you ignore that, or you don't know that you need to do anything about it, or you don't do the exercises your physio gave you, what can happen is that muscle can waste away further and become even weaker. But you basically take away one of the muscles whose job it is to stop shearing and excessive movement at that vertebral level, and that can lead to further disc breakdown. If we move on now to the front wall of your house, the layer that everybody knows of as the core, the transverse abdominis, your deep abdominal muscle. What is really important for this area is that it's a symmetrical contraction, that you can get the right and the left side to work well together, and that it works well in unison with all the other muscles of the core. So, for example, the pelvic floor, the transverse abdominis, and the multifidus should actually be able to co-contract. So they should be able to contract together in order to provide stability for your pelvis and your spine, to prevent overload of the joints and to prevent damage to the discs. Often when we see people with back pain, what we see is that if you look at their core as a house, it's a very dysfunctional house. Sometimes you have some walls that just aren't even there, they're not even working. Some are working a little bit, but only occasionally. Some are working way too much, and often the balance is just completely off. So often what we do when we see patients with back pain is we're trying to look for where are you tight and what's pulling you out of alignment and stopping you from being in a good enough alignment that you're in the best possible position to engage your core. And then what retraining, if any, do we need to do for your core to make it work properly, to make the right muscles turn on in the right order and work well with each other without things going haywire again. It is important to understand that not everybody needs core retraining. Sometimes when we take away the things that are pulling you out of alignment, sometimes your body kind of goes, oh yeah, I remember how to do this, and it wakes up on its own and it gets its core system going on its own. But more commonly, we do have to do some core retraining, and you can see that it's really important that you do your core retraining with people who understand the body well and who understand your body and take time to spend it with you in order to work out exactly what it is that you need. With back pain, research shows that your core muscles, and most particularly your transverse abdominis and your multifidus, so your front wall and the back wall of the house, can be inhibited by pain. So pain can actually stop them from turning on well. So it is a really important thing to do to go and see your physio early, to try and get control of your pain, get rid of it if you can, and try and get the right muscles turning on as soon as you possibly can, so that you're not left with a deficit. If you have back pain or any questions about this video, please get in touch with us. You can call us on 9416-4410 or get in touch or book online anytime via our website, sydneyadvancedphysio.com.au.